Hello, everyone, again, and welcome to another episode of the Time for Impact podcast with myself, Chris Wade, and my co-host.
Hi, Chris. It's Matt Cobble here. Looking forward to another interesting conversation today.
Yeah, interesting as always. And as our regular listeners will know, we always try to bring a guest speaker onto every episode who's going to elevate our thinking around volunteering and volunteerism, and help us think both strategically and innovatively about how we can improve our practice. And today we're joined by Mark Lever, formerly, I should say now, of Helpforce. I'll let Mark explain that in his own time in a moment. But Mark brings an unbelievable experience at a CEO and strategic level around thinking about how volunteering organisations run and contribute to society. So we think Mark, no pressure, but Mark's going to give us some really interesting insights that we can all learn from over the course of the episode. But let's start, as always, Mark, by saying, first of all, hello, welcome to the podcast. And maybe you can start by telling us a bit about yourself, your background, and why I'm telling people you're the former chief of Helpforce,
sure.
maybe.
Yeah, hi Chris, hi Matt, hi everyone. A really great pleasure to be doing this, and I'm really looking forward to the conversation. So as Chris says, I'm Mark Lever. I've been retired for a week. So my previous role as chief executive of Helpforce. You've asked me to give a very quick potted history of my career. So first 13 years, I was I worked in the city in finance, chartered accountant. I was a partner in a medium-sized city firm, and then having been a partner for about a year, I decided I wanted to try something different, and I was approached to join what was then the Women's Royal Voluntary Service, which is now the RVS, and this was started there in 1995. And the reason I was asked to go and join them is because I'd had a background in developing national training programs, and the WRVS at the time had about 120,000 volunteers. Doing all sorts of community-based activity. And in the mid-90s, there was a real push around areas like health and safety, food hygiene. This was just starting to emerge for a lot of the charities. And they were looking to develop national training programs for all the volunteers and the 2,000 staff that we had at the time. So I'd got a background in developing those programs, and I was asked to go and do that, alongside utilising a donation of £3 million that they'd been given to invest in training. And the opportunity there was to either invest it in the training programs itself, which I thought with over 100,000 volunteers, you'd probably get through quite quickly, or to come up with a different idea. And the idea I came up with was to invest in a residential training centre that was a sort of social enterprise, really, that would offer training facilities to commercial organisations and use the income that was generated from that training centre to fund the training in the RVS, and also give us a head office base. So essentially what I oversaw was the migration from a head office in Brixton to a residential training centre in Oxfordshire, which we acquired from WH Smith's at the time. And that generated a significant income every year, which went to fund the training programs for our volunteers, and also gave us a spiritual home, a central home for the training. So I was there for 13 years. The last 6, I was chief executive, oversaw the transition from being government funded to getting no government funding at all, which was a challenge. They had a single grant each year of about, which equated to about 60 or 70% of our running costs. And we had to move away from that and develop a more commercial sort of training model, which I did. So after 13 years, I was then ready for a new challenge, and I was approached by the National Autistic Society to become their chief executive. And the challenge there was to try and put autism on the map. And so I joined the NAS that would have been about 2008. And the challenge there was to put autism on the map and to help develop the branch network and volunteering within the NAS, as well as the paid for services that we ran loads of local authority contracts for education and adult social care services as well. Stayed there for about 11 or 12 years. And then I was approached by Helpforce, which is a very small charity, which focused on evaluation of impact of volunteering in the NHS. And it was a it was in its early stages, about 3 or 4 years, but it'd been set up by Sir Tom Hughes-Hallett, Paddy Hanrahan, Anna Dixon, had all been involved in setting up, and they were looking for someone to take it to its next stage of development. And the last 5.5 years is what I've been doing there. But I got to the age of 64 and I thought it was time for a change. And so I retired just at Christmas. They got a great new chief executive who's going to take it forward into its next stage of development. So my career has been involved with two very large national charities. The first one, obviously, the RVS, with significant numbers of volunteers and volunteering. The second one, through its branch network, had a lot of volunteer action, but a lot of very community-based support and action. And obviously, with Helpforce, it's exposed me to sort of NHS volunteering and evaluation of the impact of volunteering as well. So some quite mixed and varied experiences, highs and lows along the way, but lots of learning as you go through.
Yeah, absolutely. I think I've actually seen you won't know this, Mark, but I've actually crossed your path a couple of times over your career, both at RVS and NAS. But the thing most recently, especially with Helpforce, that I suppose really chimed with me, and it's no accident that the organisation's called Time for Impact, I suppose, is watching the work that Helpforce have, I think, really led the way on across the volunteering world, and certainly in the UK, in terms of really trying to shine a light on the impact and the value and the social contribution that volunteering brings, in a way that really, at least my impression is, really sort of builds a business case for volunteering in actually quite commercial terms in lots of ways. And for me, that's a breath of fresh air, and maybe you can tell us a bit more.
Sure. I think really it was born out of two things. One is that we felt that Sir Tom coming from sort of Marie Curie, where he'd seen volunteers used in a much more hands-on sort of frontline way, and me coming from RVS and the NAS, we thought there was a greater opportunity for involving volunteers in the NHS in that health and care journey, really. But we also recognised that there was sort of really low levels of investment in volunteering and volunteering infrastructure, and that a lot of the really good volunteering organisations had recognised that you need to invest in that infrastructure. You need to invest in good quality volunteer management leadership. You need to invest in reimbursing expenses for volunteers. It requires investment. And it was becoming increasingly hard, and we saw a lot of volunteering organisations struggling to get the necessary funding. And so we felt that you've got to make the business case for volunteering. So the importance of measuring the impact of volunteering was linked to the importance of having to make a business case to get properly invested and properly funded services, really. So a lot of the work we've done is continuing to be done at Helpforce, is looking at how do you look at that much broader impact of volunteering and voluntary activity and measure those impacts so that you can actually create a business case for that volunteering activity. And that's sometimes, one of the dangers in doing that is that people look at it and think, but you're overlooking the benefits to the volunteer themselves, or this should be about the volunteers and the benefit the volunteers get from this, and not about, the broader benefits or how it supports the NHS or how they might support local authorities or local communities. And I get why people say that, but equally, I see that it's really hard for voluntary organisations to attract the funding. And if you are going to attract funding, you are going to make a business case, you've got to look at those bigger impacts that volunteers make beyond the impact on the volunteer themselves. I mean, I think the impacts on volunteers or volunteering are well rehearsed. I mean, nobody denies that. I mean, we see significant, positive impacts around mental health, reduction of isolation, creating greater friendships, engaging with your local community, building skill sets. All that stuff is really well rehearsed. Where I think it's less rehearsed is actually the broader value to the community, to the health and care system, and those people who would benefit from working with those voluntary organisations more effectively. And that's the way you can unlock new sources of funding, really, I think.
I wonder, Mark, from my perspective, if there's almost like a third way here, which is actually everyone benefits, and almost that's a win-win-win scenario, right? My view, I think, is like when volunteering is at its best, volunteers are drawing from it, organizations are drawing from it, and people who are receiving that volunteering or whatever, or the community that's receiving that volunteering, is, there's kind of like a win-win-win there. And if we are doing, if we as a sector, if we as leaders of volunteers, as we as leaders of organizations leading volunteers, are doing things right, we're thinking about those kind of three areas and what that actually means. And I wonder if also part of the challenge is about a challenge to all of us, really, to really think hard about the difference we're trying to make through the work we're doing as organizations, and trying to define that more tightly and more clearly sometimes, which, I've certainly been part of organizations over the years that have really been trying to dig into this in a really sort of positive way, and trying to move from the position of going, yeah, like we know it works because we see it works, or it sort of intrinsically feels like a good thing, to a slightly more kind of, actually, we want to quantify this a bit more and get a bit more specific. I don't know if you've seen that in your journey across different volunteer organizations over the years.
I mean, big time. I mean, let's get down to the brass tacks. If you're going to unlock funding, a finance director for an organisation, whether that's a local authority, whether it's an NHS trust, whether it's an umbrella body, whether it's a funder, they've got to be convinced that they're going to get some sort of return on that money they give you. And so you have to give them that data, that insight, those details. So I use just one example. We were invited, Helpforce was invited to go and put together an evaluation for the community hubs down in Cornwall a couple of years ago. Brilliant community hubs, voluntary sector led, lots of charities involved in these community hubs. And one of the things we were exploring, what was the impact of these community hubs on the people who were using them? And one of the key things that came out of it through our surveys was that 50% of the people who use the community hubs said that if they weren't there, they'd go to their GP instead. Now, these are thousands of people using these hubs. So suddenly you've got a voluntary sector provision that is taking pressure off the health system, taking pressure off GPs. You've got a really strong business case to be made with that. And as a result of that, they then use the evidence from that evaluation to then go and get more funding. And in fact, they've got sustainable funding for those hubs. So all of our work has been involved in getting some of those impacts, which you wouldn't ordinarily think about measuring as a voluntary activity. You'd probably talk about, people happy when they come here, is their satisfaction, do the volunteers get a lot out of it? But you probably wouldn't think about, okay, what's the impact of this hub on a GP practice or, local GP service? And I think because people don't think like that, and I'm talking about these communities, so I've become very much more focused on community-based voluntary sector activity rather than, my previous large national organisations. Think about how do you sustain those smaller local community groups and community activity, because they're the ones that really understand how those local communities work. They're the ones who really engage with local communities. They know their way around the system, and it will be different everywhere. And I think by helping them think about the broader impacts they can make in their area, which they probably don't have time to do or don't necessarily have the expertise to do that, you can really get them to think differently about the way they might approach funding. Because a lot of the funding bids is about the volunteers, and of course everyone's going to say volunteers are great. Nobody says, "Oh, we hate volunteers." They don't add any value or anything like that. But a lot of people will say, "Yeah, we get that volunteers are great, but actually we don't have the money to give you any more funding," and so their funding gets cut. But of course, there's an unintended consequence of that. So if you take let's just take a hypothetical example. In my previous life at RVS, we used to run lots of good neighbour schemes and social transport schemes. So I've spoken to many directors of nursing as part of my Helpforce work, and they will tell you, and there's one in particular who have told me, that 20% of the beds in that hospital are full because the people in the beds don't have the support of a family member either to take them home or to support them for a few days when they go home. Now, this is classic voluntary sector territory, volunteers stepping in to take on that sort of quasi-family support type role. So we're not talking about trained domiciliary care workers, we're talking about family members, just checking there's milk in the fridge, checking they're okay, checking they know how to get their medication, maybe going to the shop for them, that sort of stuff, driving them home from the hospital. So you then say to this director of nursing, chief nurse, actually, there will be a social transport scheme in the area that could perhaps expand its capacity to help take people home from hospital, voluntary sector, there will be good neighbour schemes run by local community groups in the area that with a bit of extra funding could expand their capacity to provide that support. And when you start to talk to the NHS about the levels of funding that are required, because we all know that small local community groups run on sort of fresh air, they're amazed at how efficient that can be compared with the cost savings that could be made, or compared with the financial impact of freeing up those beds more quickly. There is a very, very clear business case for diverting investment to those smaller community groups.
Feels like there's a challenge there for me around, we often hear about the pressure that the NHS is under. We often hear about the sort of power of local community, and we see that in action in lots of places. But it seems to me that the role of volunteers doesn't always seem to be part of the conversation when certainly not the national conversation at the moment that I see when it comes to tackling some of these sort of bigger societal problems. We sometimes get to the fact, we sometimes almost stop at underfunding. It's almost like or we stop at reform. But it feels like this is a more sophisticated response to going, okay, what is the role of community in all of this? But not just the role of community in solving a problem, but like the value of community as well, which maybe brings us back to impact a little bit as well. If we're really clear what the differences we're trying to make and see, we can be clearer about where the solution to some of those challenges might be.
I mean, when you look back to COVID, national crisis, emergency, communities stepped up. It was local communities that stepped up and responded to that need. And the senior leaders within the NHS realised there was life beyond the hospital car park. And they could see the value of these smaller community groups taking pressure off the NHS. I think bureaucracy, funding, pushing local community groups to the periphery, that's all sort of rolled back again, and we've gone back to where we were pre-COVID, unfortunately. But I do think that with the crisis that's described around the NHS at the moment, particularly around people on trolleys in hospital corridors, massive waiting lists, there is a way of taking some of the pressure out of the system, and it is by looking at how you can make better connections with these smaller community groups that exist in one of the ways that I've just described. But to do that, you need to invest in some infrastructure to create a portal for the large NHS, just taking this as an example, the NHS hospital, to access those groups, because there are thousands of local community groups, and it's a way of looking at how can you organise those groups differently. It's not about creating new organizations or new structures. It's about investing in what's already there, but just bolstering it and strengthening it. And one of the unintended consequences you get is because local authorities tend to fund the local community groups, in this sort of example, the NHS tends to benefit from them. So you could get the situation where a local authority would be looking at a social transport scheme, which they might be giving 30,000 a year to, let's say, and saying, look, we can no longer afford to fund this. We don't, the transport scheme probably hasn't been able to provide any impact evidence for really good reasons. Maybe they don't know how to do it. Maybe they haven't got the resources to do it. So that funding gets cut. So when the local authority comes knocking, it's not that local group isn't there anymore. Whereas if they knew it needed a bit of extra funding, it would make perfect sense for the NHS to channel funding into that group to keep it running, because the cost benefit to them would be really significant. And actually, when I've spoken to directors of nursing, you talk about the costs of a local transport scheme, they will look at that and say it's just a no-brainer. It's just nothing to them in terms of 20% of the beds being full. And in fact, we evaluated the transport scheme up in North Tees, and we found that there's obviously a cost to running it, but it's 50% of the cost of using taxis. There's a clear financial benefit of running these.
And some of that's about knowing the audience that you're trying to make the business case for as well. I mean, you talked about being able to make the case to the finance director in a language that the finance director is going to respond to in terms of understanding return on investment. There's the business case to the local council there's the business case to the NHS, but there's also something about the business case quite often internally to the organisation. So, you talked earlier on about nurses or nurse directors understanding the value that volunteers bring, which I'm sure many of them do very well, but some will understand it less so. There is that element of volunteering seen as a nice thing, but something that historically is seen as free and not
Yeah,
worthy or not necessarily needing investment. And I think the table has begun to turn on that, but I still think there's a long way to go, not just in the NHS, but within charitable organisations that we all work with.
yeah,
I still come across quite a lot where that case to the finance director and that case to the CEO and to the board has not been made, such that they can't even get the funding to pay for doing the impact evaluation work that they
yeah,
need to be able to make the case in the first place. So it's kind of cyclical. And my attitude has always been to the volunteering profession, don't moan about that, do something about it. The onus is on us as a profession to find ways to demonstrate the value that volunteering brings to society, to the investors, to the organisation, to volunteers, and also the potential that volunteering with a bit of investment could bring even extra value in the future if that
yeah.
investment was well made. So what do volunteering professionals need to be doing to up their game to be more successful at making not just a good business cases, but a case for a business case in the first place?
Yeah, I think it's really difficult because all the volunteer leaders that I see and I've known over the years, passionate, dedicated people, and as I say, they run services on a shoestring or fresh air, it's incredible what they do. But a lot of the focus for many, a lot of the focus is on the volunteer experience and what does the volunteer get out of it. And often the easy thing is talk about the numbers of volunteers or the number of volunteer hours, and then probably multiply that up and say, if you multiply it by the living wage, here's the potential value of it, which doesn't really mean anything to anyone.
It's not an outcome, is it?
Whereas talking about the impact that volunteer service has on that broader sort of system. So you could talk about actually what's the impact this is having on pressure on local GP services, or what's the impact this is having on local NHS, or what is the impact this is having on health services, because the volunteers themselves, the benefit to the volunteers' own mental health, reduction in socialisation, what's the impact on them of not using those services anymore. So, as Matt was saying, there's a much broader range of impacts that you have. And one of the exercises we go through when we're talking to volunteer leaders is, let's just map out every possible impact you could be having, your volunteer service could be having. Clearly, there's the impact on the volunteers themselves. Clearly, there's the impact on the people who are receiving support, whatever that support may be. And then what's the impact on the broader, local community? What's the impact on the local health service? And you say, right, when you go and talk to one of these for funding, it's those impacts you want to talk about. You want to match the impacts that you're delivering with the conversation that you're having with that person here. Talking about the impact on the volunteers and the positive experience they're having probably isn't going to be as persuasive when you're talking to the finance director in a local authority as it might be if you're saying this would reduce the impact on your domiciliary care budget. Because what happens in the space I've been operating in the last couple of years is that to get people out of hospital where there isn't that family support, a number of patients are pushed up onto a domiciliary care pathway. So they're put into domiciliary care, which is really expensive for local authorities, just to enable them to get them out of the hospital, when actually with that lower level family/volunteer support, they wouldn't have to go along that pathway. Yeah. So you can make a case to a local authority for actually investing more in those good neighbour schemes. But you need to have a vision for how you manage that. What's the infrastructure for managing those referrals and supporting the growth of those services to meet the demand. But by keeping it local, people respond to that local need. I think we saw it during COVID. We see it all of the time. I mean, when you look at the research that comes out of NCVO all the time, what's your main reason for volunteering? Helping people, improving my local community, helping people is invariably at the top of the list. Maybe there's then a personal connection to the cause. So you've got older parents, and one of the reasons why I volunteer is because I know some people who've been lost jobs and have been on hard times and ended up not losing their home but close to it. And I think actually we need to make sure that there's support for rough sleepers and people who are falling on hard times. We're appealing to people in local communities to support their own people in their own local community. I mean, that's what that's what we're doing, and we can make a really strong case for doing that. There's this whole ecosystem that overlaps in, so it probably doesn't overlap enough. You've got those smaller community groups, you've got the impact of the larger voluntary organisations that might have a branch within those community groups. You've got the local authorities that provide some funding going in there. You've got the local umbrella bodies. You've got people contracting with the local authority in the area. You've got corporate support. You've got a whole load of people who've got an interest in the strength of a local community. And if you can bring those elements together and talk about the impact that volunteering can make on some of those community goals, whether it's the health service, whether it's care service, whether it's community cohesion, you can make a really strong case for those organisations to work more closely together to support local community groups.
It feels like you've got the business case for your financial director, you've got the business case potentially for your trustees, you've got your business case you've got your internal business cases, but there is the business case almost for society around some of this stuff as well, right? About the impact you're trying to make. And if we're gonna convince society that volunteering is important and really can shift the dial on some of these things, which, let's be blunt, are a crisis, right? And we see volunteers step up again and again and again. When we frame these things as a crisis and we really clearly articulate the difference we want volunteers to make, and we make it really easy for them to be part of that, we see people coming forwards, right? I think that is something we have consistently seen. Right now, whether we have the ability to kind of execute on that in the long term, I think or whether that is sustained is a different challenge, isn't it? But it feels to me like, from a marketing perspective, where have we seen these big moments of response? It's around these kind of, it's either around moments of sort of national kind of objectives, deliver the Olympics, stuff like that. It was a moment, right? Or it's these moments of crisis and need for togetherness that we've seen in things like COVID, or response to Ukraine, or things like that. It's really interesting, I think.
When I was at the RVS, one of the areas of work we had 16,000 trained volunteers who were on standby to support the emergency services in times of a local crisis. So there would be, there might be floods, there might be plane crashes, there might be rail crashes, there might be fires, but there would be things that came out to support the emergency services at Dunblane. There were trained volunteers who would come out 24 hours a day, just feeding and watering emergency services and providing support to families who are affected by this. Because in your local community, that community response, people will step up and they will go out and help. So when COVID struck, you saw this massive community response. And I think it really just mirrored the response that you saw to local crisis and local emergencies, but it was a national crisis, national emergency. Everyone came out to support, and everyone was looking for ways to support. I mean, at Helpforce, we were sort of in the eye of the storm to a certain extent, working alongside NHS England. Corporates were coming out saying, right, how can we help? Local businesses were coming out, how can we help? People, everyone was saying, how can we help? And actually, nobody had really thought about, how do we manage all of this? How do we manage this outpouring of support? And of course, what we've got to do now is to think about, we do have a crisis. I mean, we're told that we've got a crisis in community care, social care, NHS. How can we identify a legitimate role for local community organisations to play a part in that crisis, not to take all of the stress, not to dump on what tends to happen is poor old community groups tend to get dumped on, but actually, what's the legitimate role for these smaller community groups to play? How can we create an infrastructure where they're connected better so they can support each other, so they can work together? How can we create referral pathways to take some of the pressure off the system? They're not the answer to the whole NHS crisis, but they can take pressure off the system and start to unblock some of these blockages that exist. The 20% of people in beds who could be at home if there were family members to support them. How can you design a system where that happens? And of course, that requires, as I say, that sort of ecosystem. That requires a number of these players to think differently about the way they support financially, but also structurally, the local voluntary and community sector.
And I've heard people like British Red Cross, for instance, talking in a similar terms over the years, usually on the back of an emergency that's come along. Yeah. They've realised how difficult it was to coordinate all these local community groups and individuals who really want to help and can make a difference, but as you say, are either swamped and unable to work, or they're not connected up.
Yeah.
but actually there's a role for organisations to play a sort of convening role as opposed to orchestrating everything that goes on. And with that, obviously, you also need to make the business case up front to get the funding in place for these things to happen before the natural disaster or whatever takes place, don't you? And that's, I think,
Yeah,
is part of the challenge.
and the other challenges. I mean, I haven't been at sort of RVS for a long time. The national sort of voluntary sector organisations, they have a national profile, but they don't necessarily have a national coverage. So they're not everywhere. They are they're dotted around the place.
No.
The only voluntary sector organisations that have national coverage are those smaller local voluntary community sector organisations that exist in local communities, and it's difficult to engage with them as a group, and it's probably the reason why we haven't done that so effectively, because people have looked at it, that's just too difficult, isn't it? But actually, what I see, I mean, one of the changes I see between now and when I first started in over 30 years ago was the quality of leadership at local community level in some of the umbrella groups and the voluntary community sector. It's really not being disparaging about the people who are running those local community groups like 30 odd years ago. But actually now you see people who've made career decisions to go into that space. It's not people who have retired and are looking for something to do and to run these groups. There's really good quality, far more diverse engagement in these organisations, good quality leadership, much more professional. And I think we should be trusting the local community leaders, the local umbrella bodies, infrastructure bodies, much more to organise the voluntary sector and have, be a serious player in those conversations. And I sometimes think, when I talk to some of these people, there's a sense of frustration that the easy solution is to look for a national organisation to commission or to give a chunk of funding to, which then gets diluted and lost as it moves its way down the pyramid. Whereas actually, if the funding was given directly to local community infrastructure or local voluntary community sector organisations, you sense they might be able to have a greater impact with that investment as they go, as they're trying to corral these organisations around particular local challenges that they face, and they will be different. I'm sat here in a village in Wiltshire. I'm from Shrewsbury originally. On the face of it, you might think they're quite similar, but actually the whole infrastructure, the way the organisations work, could be completely different. How could I possibly sit nationally and say, this is what we're going to do, and here's a blueprint for all of these organisations, when actually the best people to know what would deliver an impact would be the people who are operating at that local.
And I guess that also means devolving budgets, which is a whole other issue.
Yeah.
Sorry, Matt, I know you wanted to come in.
I just think that leadership bit is a really interesting kind of, particularly in larger kind of organizations or charities, and like the importance of a shared sense of ambition, but also the trust to devolve things and devolve decisions and devolve operation where necessary. And that requires, I think in my experience, quite a lot of trust, quite a lot of bravery. It requires people to feel supported and enabled, but it also requires good leadership locally and an investment in good collaborative, supportive leadership kind of thing. I think you touched on something there for me, which I think is so important and often kind of unsaid in terms of the important investment in supporting and enabling kind of leadership there. And it's sometimes fostering that is so important rather than trying to control too much, but equally developing leaders is so key to that working well. And then I go to this kind of place of going, well, the amazing kind of leadership and innovation that started organizations often in local communities, and the difference between the kind of leadership potentially that's required to start something and innovate something and the kind of leadership that's required to sustain and kind of respond is, I'm not sure exactly where that thought is going, but I just think there's something really interesting when you say, actually, we want to devolve, we want to empower communities, but really supporting good community leadership is so important. And that might look different for different organizations at different stages of their development.
And I think there are sort of notable examples of where large national organisations have collaborated around national initiatives. So the Big Help Act's a really good example of that, actually, where RVS, Scouts and others collaborated to create a national program, national initiative. But I think that is very different to collaboration at a local community level. And by local community, I'm thinking sort of county type, how do you bring that collaboration at a county level? Where you bring people together at county level who understand what's happening in their community, all the different organisations in the community, encourage them to work together, work with the local authority and the NHS Trust to understand what the challenges are and bring those organisations together. I can remember we were involved in a programme in Warwickshire, actually, to look at how the local voluntary community sector could support people being discharged from hospital. Identified loads of the local community organisations, brought them together into a meeting. And that was probably one of the most impactful things we did, just by making people aware of who was on their patch and saying we can reach out to these people and we can collaborate with these people and we can engage with these people. We did something similar in West London. We just brought lots of people together who were involved in supporting the mental health of young men in a particular area. And it was like the local shopkeepers, hairdressers, local community groups. And just by bringing them together to make them aware of each other, they start to collaborate and work together in a way that doesn't happen nationally, because it's just there's too much machinery nationally to have that informal collaboration. But you're trying to create a community mesh or a safety net for particular challenges or problems. In that case, it was looking at how can we support the mental health of young people in these communities, and it was looking at how can we train up people to be more aware of people, how local shopkeepers, hairdressers, how can we make people understand that there are resources and support around that you can refer people to. And it's just such a powerful model. It's difficult to achieve, but the first step is to bring those groups together. And rather than saying, how can we get the voluntary and community sector to work together more effectively, which is such a nebulous concept, it's nuts, is how can we actually identify local voluntary and community organisations that could provide support to people who've recently been discharged from hospital. Let's bring all those organisations into a room and say to them, look, how could you organise yourselves? Because it's got to come from them. How could you organise yourselves to provide support to 100 people a week who've been discharged from hospital that need this type of support, shopping over the next week? And let them come up with a plan and say, right, how much money would you need to do that, to increase your capacity to do that? Bring us a figure. And then you could start to say, actually, what is the business case? If you go to a local authority and say, look, these guys, they could support 100 people a week. They could organise themselves to do it in this way, but they would need X £1,000 a year to do that. Is there a case for that? And I could almost guarantee that the frugality of local community organisations would be stunning to the NHS if they looked at that model. So you'd get the NHS unlocking some of the challenges they face, but you'd also get these local community organisations being able to invest in their infrastructure to strengthen their infrastructure.
As I understand it, the NHS trusts have been, at least on paper, tasked with involving their communities much more in their planning. But I don't see a lot of evidence of that happening in practice. But actually, what you're describing, Mark, is in a sense almost that you need to engage them with a shared purpose as a community. Provide the resources, the infrastructure, and the funding, but as much as possible, get out of the way and let them deliver to that shared purpose.
The worst thing that could happen is for a bright spark within the NHS or NHS England to dictate to these local community groups how they should do it. Present them with the challenge and what the output is that they require, and let them work out the best way to do it and how they need to be funded to do it. And I think if you invested in that, you would start to see greater collaboration at a local level, strengthening of those community organisations who are on really flag. I mean, a lot of them, so many small charities are going to the wall at the moment, but a lot of their infrastructure would be strengthened. They'd work out ways to collaborate more effectively together and have a far greater impact on some of those local community challenges. And actually it would be the essence of community, because when we talk about community, what do we mean? It probably is that sort of voluntary organisation of me living in my community, reaching out and helping a particular person or a particular group that is going through a rough time or a tough time or needs a bit of support. I mean, what is community if it's not that? So it's, that creating an environment where people can volunteer and support and help people locally is what actually strengthens those communities.
It seems to me sort of starting with that principle, and perhaps there's something we can all sort of think about or learn from this as well, this idea that like if you start with the mindset that the answer is out there and not in here, you start to operate in a different way. You start to, you start to devolve things, you start to trust more, you start to convene rather than control, you start to sort of treat the community as the consultant, and by that I mean the sort of the expert with the experience who is going to come up with the solutions to this challenge you've got, sort of thing. And yeah, it feels like a real mindset shift around how you work with people to get things done. um
Yeah, I mean, if you think about the way stuff happens, somebody will think, we need to, there is an opportunity to involve the voluntary sector in this, whatever this might be. And so they say, we'll find some money for this. So they'll find a pot of money, say £100,000. They'll write a tender specification. And they'll say, we want an organisation to do this, this, and this, and we want to see this, this, and this. Put your bids in, and there's this funding. And everyone piles in to do it. You probably get a lot of the larger national organisations saying, well, there's an opportunity here to do some funding, far better resourced for writing those funding bids, and are likely to write a better funding bid. So they come in, they get the funding, they set up a service in a scheme locally, probably from scratch, or grow one of theirs. Funding runs out, off they go. They're not there anymore. Whereas the smaller local voluntary community sector organisations that have been there for years will always, there'll always be that infrastructure there. So rather than starting with the funding, start with the opportunity. Describe an opportunity for people to work together and bring a proposal to the funder, which in a lot of cases, I think they'd come up with a funding requirement that is less than they imagine it would be. It's just turning that approach on its head and encouraging people to come up with ideas for that funding, I think.
Yeah, I love that, Mark. I guess the barriers in my head are the sheer cultural shift from an NHS or a council organisation, which is presumably pretty bureaucratic, process-led, risk-averse, to a local community organisation which is nimble, agile. There's getting a shift in the mindset for those presumably in the NHS or the councils who are commissioning this sort of work to think and be free to think in a very different way.
Yeah, I mean, what's missing is that facilitating and convening role. So, I'm not pretending this is it. I mean, if it was easy, everybody would be doing it. But if you had a neutral person who was a facilitator convener, could actually, they invested in someone who'd come in, who's got a genuine interest in that community development, and could sort of convene these groups, facilitate the conversations, and help them shape that proposal. That would be the upfront investment, really. And it's probably not someone who is from the local authority or from the NHS. It probably is a genuinely independent person who could facilitate and convene those conversations and help shape up what a proposal might look like. That investment in that person, that resource, could really pay for itself in terms of the quality of the proposal that was produced, but also in the level of engagement you get. And of course, why do we see lower levels of participation in more deprived communities, in more diverse communities? And it's usually because the model of engagement that is expected from the people who commission from the centre just doesn't fit with the way that some of those communities actually operate, and they don't have the resources to respond to that. So by having a more neutral sort of facilitating convening role to work with the local communities around the challenges that they face, you're more likely to get greater engagement within those more deprived areas or those more diverse areas, and get greater involvement in community activity than you do by having these centrally produced one-size-fits-all sorts of tender propositions.
It seems to me as well that if you couple that approach with this notion of like good community leadership as well, you also, like some of the stuff that Chris was talking about earlier about the sort of the risk mitigation and the challenges start to get, be addressed a bit more as well. Because actually one of the things that is hard with managing risk is when you have a big organization, trying to manage the same problems in the same way in every community setting is quite challenging. And that's when you start to become quite black and white about things and trying to get everything to operate in the same way. If you also devolve the risk thinking to that local leadership, you start to also get to approach as well, don't you? Which is potentially almost going to come up with better solutions to better challenges with the right support in place, I think.
Yeah, and I think it's naive to think that you can eliminate risk. But if you look at, I can remember talking to someone, and they were saying that I would rather go and support this person as a neighbour than as part of a national organisation's team, because I probably couldn't offer the level of support that I'd like to if I was a visitor. I won't say which national charity it was. It's not one that we've mentioned. But if I was a visitor with their badge on, I would have tick all these, and I probably wouldn't be able to do some of this stuff. And yet here is a person I know in my community who desperately needs support. My mother, she's 86, and she goes around helping the old folks, and she'll cook them meals and take them round to them. Now, there would be national organisations that would shudder about her doing that. Now, as far as we're aware, she hasn't killed anybody yet. But she's just doing that. That is a community response. But as you become these larger organisations, something terrible happens, and then suddenly everything gets clamped down. And there are obvious reasons and understandable reasons why we have these structures in place and why we have these management of risk factors in place. I remember all the CRB checks, DBS, the iterations of that. A lot of that really came out of the Soham murders. We had a school caretaker in a position of trust. Desperate, terrible situation, and that desperately tragic incident. You can't let something like that happen again. So you have massive risk structures, but then nothing is without risk. So how do you? I think one of the challenges is to look at how do local community groups manage risk and mitigate risk, because by definition, you're probably supporting vulnerable people. You're probably supporting people who are vulnerable, but that shouldn't be a reason not to do this.
I wonder if there's something we should be learning from North America. I think last time I looked, something about 17% of our listeners are from North America, so they may have a view on it. But I keep thinking about that sort of concept in America of community organisers, which we don't really seem to have. And I know there was some move towards that with the big society to have some kind of community organising role, which never really got off the ground. But I wonder, maybe because, of course, in North America as well, budgets, decision-making authorities are much more devolved than they are in the UK as well, and that may have an impact. But I think there's also a culture and a history of people working across groups in the community to make things happen in America that we don't seem to have. We seem to be more centralised in the UK.
Yeah, I think that the worry is that you suggest, I'm not saying you, but one suggests this to somebody in a position of authority in government, and they decide, right, we're going to put community organisations in every community. The community organisations need to bubble up out of those community groups, and I could almost, and that might be a respected organisation, within local communities. When I've been working in that space, you can instantly tell where there is trust amongst those different community groups, and you can also tell when there are massive turf wars, battles for funding. And in a lot of cases, those turf wars and battles for funding have been a result of the way those organisations have been sort of commissioned in the past. Because funders underestimate their ability to impact the behaviours of organisations, I think, by the way they present the funding or the way they present a funding opportunity. So I think that if you had one of these facilitators or conveners bringing organisations together and creating that trust amongst the organisations, a leading organisational person would bubble up from those groups, who would be the community leader in that case. It's a powerful role, I think.
Well, fantastic, Mark. I think this has been one of my favourite conversations on the podcast. If I'm honest with you, we've really,
very kind.
We've really dug deep into a couple of issues. We've not gone wide with our conversation, but we've really dug deep into the concepts of value and impact, and of really enabling community action within our communities. Thanks, Mark. I think it's been a brilliant A brilliant,
I've really enjoyed it. Really enjoyed it, and great to see you again.
fantastic. Well, so Matt, as I said to Mark, I think that's one of my favourite episodes ever. The enthusiasm coming from Mark and from us as a result, I think was quite palpable this end. Such deep analysis and thinking on the issues was really, really impressive. What were your takeaways today, Matt?
It seemed to me that this was the one that really kind of tried to summarize that it's the time for impact, right? That if, really got to the heart of a lot of the stuff we often talk about. I think that conversation about impact was really insightful for me. And I think this idea of using impact to generate your business case is key. But I think what I'm taking away is that business case can be for different people and different audiences, and you're going to need to tailor that business case. And the business case also, perhaps, we're all involved in building business cases that perhaps we're not even aware of or we don't expect. So there's the business case for your CEO, there's the business case for your financial director about the value and return on investment. But there's also other people that need a business case as well. There are communities need the business case about why the offer is important, what difference it's going to make, how it's going to work. And I sort of reflect back to some of my time in volunteer organizations as well, where I've been trying to galvanize kind of local communities to get involved in something, and I wonder, like, maybe if I've been thinking about that as a business case more rather than as someone kind of within the organization who intrinsically believes this is a good thing, there would probably be a bit of a mindset shift there for me, which is like, I don't need to just convince these people to do something. I also need to really convince them of the value of something and why their investment of time is going to be worthwhile, and not just worthwhile, but what it's also going to generate for the community and for them. And I also think there's probably a piece there for me as well about, we've talked about this on various podcasts, but about the sort of national conversation about volunteering. And I wonder if there's something for all of us to think about as well, which is like, what is our business case for wider society about volunteering and its impact and its importance, and who is making that business case and whose responsibility is that, and what role do we all have to play in that? And I still believe, and I think it comes across hopefully to those people who listen to this podcast, volunteers have really stepped up at the moments it's mattered. And I just generally think part of our collective role needs to be to help people understand when it really does matter and what they are responding to and how they can respond to it. That business case idea, for me, I think is a mindset shift and something perhaps we could all think about a bit more.
And beyond the business case, really once and for all, thinking about what infrastructure or coordination is needed to really enable the power of community and the power of people within community to do those things, like you said, to step up, as you said, Matt, on a regular basis, for organizations to enable that to happen, but not to get in the way, to help articulate and collaborate with communities to find that shared purpose, but then not to come along with all the solutions or to put unnecessary bureaucracy or structures that actually hinder those communities' ability to actually volunteer their time to make a difference. It's not easy, let's be honest. Getting that right is almost a generational challenge, but it feels, as volunteering leaders, that's something that we as a community really need to grapple with, both as individuals but also within our organizations. Big challenge, but one we have to grasp.
Yeah, and I think it's also important for me, we can't take our eye off the ball of that informal volunteering, how important that is. I think over the years I've been sort of guilty of perhaps looking at that data set and going, oh, well, that's interesting. But what I'm really interested in is formal volunteering, because that's generally been the kind of volunteering that I've been sort of responsible for. But it feels to me that informal volunteering is really a gateway to some of that other volunteering. And
but formal volunteering's also becoming much less about managing what people do, telling people what to do, and much more about creating a space for it to happen. So actually, I think there's some parallels there, isn't there?
And then when you start to talk about the things that enable this locally, I thought there was a really interesting reflection on, I suppose, like the importance of leadership. How do we enable, recognise, support good community leadership? I think what we've talked about on this podcast in other times about that sort of curation piece, about going, hey, look, there's a good thing happening here. How can we help to arrange things around this that enable it to sort of achieve its maximum potential, or to be able to create a really good, varied experience for it to really reach its kind of maximum potential, or to be at its most impactful. And I obviously, we didn't get to dig into this too much, but I think it'd be really interesting for something to explore on a future podcast about like the changing nature of community leadership in sort of volunteering. That's a topic I'm really enthused by as well, and one I'm definitely going to give more thought to.
I think it's fair to say we haven't found all the answers, but we've
No,
certainly identified a lot of the questions tonight. And
but
one of the answers I am intrigued in is that North American thing. So I know there's a lot of North American colleagues who will be listening and will know that kind of community organising model much better than we do. So please do get in touch.
And then the last thing today for me was this notion of like bringing people together and the importance of that. And if you start with this notion of sort of trusting that the answer is out there in our communities, and that communities will work well to solve problems together, like if you start with that mindset, if we can convene rather than control and get out of the way and let communities come up with good solutions, be the experts by experience that they are, that can lead to really good results. I think it's a really important challenge for us all as we navigate the current landscape of volunteering, which does at times feeling increasingly complex. But maybe the secret to unlocking all of that complexity is trusting and relying on local communities to solve some of those answers themselves, really.
Wow, so much food for thought in this episode. If anyone listening has got some feedback and some thoughts and some input that they think may add some even more value to this conversation, of course, as always, we'd love to hear from you. So please get in touch via our website, www.timeforimpact.co.uk. If you'd like to be a future guest, or you have a recommendation as somebody who we really must reach out to, again, please let us know. If you like what you heard, please follow our podcast and give us a good review if you're able to. And of course, podcasts like this really get spread through word of mouth. So if you've enjoyed what you heard, please tell at least one other person, and hopefully we can keep sharing the knowledge and sharing the inspiration across the profession of volunteerism. And lastly, of course, Time for Impact exists outside of this podcast, providing training, learning, events, consultancy, and particularly, obviously, related to the title of our organisation, we do specialise in helping teams demonstrate and leverage the impact of volunteering. So do get in touch if you think we can help. But for now, thanks for listening. See you soon.
Bye.